Hello viewers, I am Dr. Sumina Reddy, Chief Fertility Consultant and Laparoscopic Surgeon, Mira Fertility, Hyderabad. Today in this video, let us discuss about endometriosis and can it cause infertility. First, let us start with what is endometriosis. Endometriosis is when tissue is found outside the uterus that appears similar to the lining of the internal layer of the uterus called endometrium. Endometriosis may grow on the outside of your uterus, ovaries and fallopian tubes, and even on your bladder or intestines. This tissue can irritate the structures that it touches, causes pain and adhesions on these organs. How do you know if you have endometriosis? Many women with endometriosis have pelvic or abdominal pain, particularly with their menstrual bleeding or during intercourse. Some women who have no symptoms also can have endometriosis. Endometriosis can make it difficult to become pregnant. In fact, 30 to 50% of infertile women have some mild degree of endometriosis. Sometimes endometriosis can grow inside your ovaries and form a cyst called as endometrioma. This usually can be seen on ultrasound, unlike other endometriotic tissues. The only way to tell for certain if you have endometriosis is through a surgical procedure called laparoscopy, when nothing else is seen on ultrasound or MRI scan. Does endometriosis cause infertility? If you have endometriosis, it may be more difficult for you to become pregnant. Up to 30 to 50% of women with endometriosis may experience infertility. Endometriosis can influence fertility in several ways. First, the distorted anatomy of the pelvis, adhesions, scarred fallopian tubes, inflammation of the pelvic structures, altered immune system functioning, changes in the hormonal environment of the eggs, impaired implantation of a pregnancy, and altered egg quality. At the time of surgery, your doctor may evaluate the amount, location, and the depth of endometriosis, give you a score. This score determines whether your endometriosis is considered minimal, that is stage 1, mild or stage 2, moderate stage 3, or severe, that is stage 4. This scoring system correlates with the pregnancy success rate as well. Women with severe, that is stage 4 endometriosis, which causes considerable scarring, blocked fallopian tubes, and damaged ovaries, experience the most difficulty becoming pregnant, and often advanced fertility treatments such as IVF and ICSI might be required. How is endometriosis treated? Endometriosis needs the female hormone estrogen to develop and grow. Birth control pills and other drugs that lower or block estrogen can be effective to a certain degree in improving pain symptoms. For patients who wish to become pregnant, medical therapy may be considered prior to attempts at conception. But this treatment usually does not improve pregnancy rates. Therefore, if you are wishing for pregnancy, you may consider fertility treatments directly. If endometriosis is seen at the time of surgery, your doctor will surgically destroy or remove the endometriosis and remove the scar tissue. This treatment will restore your normal anatomy and will allow your reproductive organs to function more normally. Your chances of becoming pregnant are improved after surgical treatment, especially if your endometriosis is in moderate or severe range. The combination of surgical and medical therapy may be beneficial in patients attempting to conceive through in vitro fertilization. Overall, treatment is highly individualized for each patient. So, endometriosis does increase the risk of infertility. I hope this video gave you the information you needed. If you want to know more about fertility or women health issues, follow our channel. Thank you.